If you're over age 40 and are experiencing varying degrees of knee pain and stiffness, there's a very good chance that you have early onset osteoarthritis. This is especially true if you have a history of playing sports, for example, any sports that involve jumping and landing, such as basketball, tennis, if you're a frequent runner, especially long distance running, or if you are involved in heavy labor that involves significant stress on your knees. Osteoarthritis is the gradual deterioration of the cartilage that lines the end bones of your knees. And what happens is you form little tiny cracks, little pits, and as you continue to do the offending motion, those little pits expand and turn into cracks and form more pits. It progresses, and the end stage basically involves having very painful knees, very stiff knees, and this could be like decades down in your life, and eventually requiring knee replacement surgery. So in this video I'm going to show you a really cool device that I use. It's good for prevention. Your best strategy if you're at this stage is to prevent those pits from getting worse, from expanding. Now you should know that cartilage, the tissue itself, is mostly matrix. In other words, there's very few, comparatively few percentage of living cells, unlike tissue that forms your skin and organs. And what that means is that the regenerative capacity of your cartilage is not that great, but it still can regenerate if the damage is not that extensive. Now research shows that red light gets absorbed by cells, and what essentially happens is that it speeds up cellular metabolism. More energy is produced. There's more DNA transcription. There's more protein synthesized. There's more waste products removed from the cell, so that it energizes that cell so it could do its thing. And in the case of the chondroblasts, secrete more matrix to repair those pits. Comes in a box, black box. Open it up. Here's the device itself. As you can see, it's compact. You've got 2 rechargeable batteries and a battery charger. This plugs into a USB port or an AC adapter. It doesn't come with one of these, but you could stick this directly into an electrical outlet and charge your battery that way. You take your device out. I pre-charged this battery before the video. Just screw it in and take a close look at that. You could see that there are 3 diodes, LEDs. You turn it on and it's got a very powerful red light. Here's a model of the knee. This is the patellar ligament. This is the patella or kneecap. This is actually the right knee. You can see the fibula here, the femur, distal femur, and this is the distal or the proximal tibia. Now the knee is a hinge joint. It moves like this, like that. These condyles move. Now this is the meniscus. This is called the meniscus here. This is the posterior cruciate ligament. And way inside there is the anterior cruciate ligament. This is the lateral collateral ligament, or the outside of the knee, and the medial collateral ligament. With osteoarthritis, the offending areas are here. This is the distal femur head, the condyles that are lined with cartilage. You may have a meniscal tear as well. If you have sharp knee pain that's very focalized in one spot. If you palpate around your knee, just know what these structures are. That big bony protuberance to the side of your knee, just a little bit low, a little inferior or below your kneecap, that is the proximal head of the fibula, so use that as a landmark. And we know that the meniscus is just about a little less than an inch above it. And from there, to the lateral aspect of your kneecap. So palpate that fleshy area. Take your red light therapy and just press against your skin and illuminate that part. And then what I'd like you to do is lie on your stomach, okay, and get somebody to apply the light directly behind your knee. Press down into the tissues as far as it'll go to get the tissue and fat out the way, so you're closest to the bone. Okay, notice how when you apply behind the knee, there's a lot of area there that's exposed that you can apply this light to. Bend your knee at a 90-degree angle. Again, you're going to expose parts of that epicondyle where some of those pits may be forming, and just hit the front of it like that, from the side, the lateral aspect, and the medial aspect. This one you could do yourself. Press into the fat, get that out the way, and just sweep the area and get all that surface area of your distal femur head. What's great about the red light therapy device is that it penetrates fairly deeply. Take a look at this. This is my hand. It's about 10 millimeters thick. I did this in a previous video, but you can see it here. I'll lower the lights. Again, you can see a better view here how this light goes right through my hand. And if it was even darker, you could see that some of it goes through the middle of my hand. So rest assured that this light is capable of reaching the cartilage deep inside your knee. In summary, osteoarthritis of the knee is a very common problem in people. It's really hard to avoid, especially if you have an active lifestyle. The best course of action if you're starting to feel knee stiffness and knee pain is prevention. Just keep in mind that cartilage does not regenerate very well, so you want to take very proactive steps, and using red light therapy on a daily basis is a good solution, one of several. Other things you could do is, if you're overweight, obviously you would need to focus on losing some of that weight, because the more weight you carry, the more pressure you'll place on your knees. And if you play sports, obviously you want to be able to enjoy life and do the things you like to do, but just keep in mind that if you jump and land, each time you do that, you're putting a lot of pressure on your knees. So I would focus on strengthening your leg muscles so that you get good shock absorption and healthy knees that will be able to withstand the trauma you subjected to. If you'd like to get one of these red light therapy devices for yourself, I sell them on my website, pulsedemf.com. Just click the upper right hand corner of this screen and it'll take you to that website. It's got more information. So give it a try. Talk to you soon.